Hi, my name is Aubreigh Parks. I'm a district nurse with Wasatch County School District, and I am reporting today on the rural school district-based COVID-19 testing site. To give some background, we found that access to testing in our rural community was considerably lower than other communities. In addition, we had a disproportionate number of low-income families. For example, 3 of our 5 elementary schools are Title I schools. So there was both financial time and access constraints discouraging testing. So we decided to open our own testing center to provide free rapid antigen and rapid molecular testing for staff, students, as well as the community. To develop this testing center, we were able to obtain a CLIA waiver, and tests were donated by the Utah Department of Health. We found laboratory space in a central location that had a parking lot adjacent to the building, that we were able to provide testing in a drive-up fashion Monday through Friday. Patrons would book their appointment online. A tester would go out, test them in their car, return back, and an RN would deliver positive results. In addition, we had to create a pretty significant database that would share information with the local health department. It would share information pertaining to testing and results, symptoms, positive cases, reported contacts, and other things of interest. As of March 1st, we were able to test over 4,400 students and staff and community members. It is of note that this did include our extracurricular testing. That does skew the results a little bit because those tests are geared towards asymptomatic population. We did have 285 positive tests come out of those tests, of the total number of tests, and there was a disproportionate number of staff who tested positive. It is interesting to note that of the 285 total tests, 42 were asymptomatic. This is 15%. We did feel like this was able to effectively mitigate spread in that 15% of positive cases due to the early identification and on-site education provided by the RN. In addition, there was a disproportionate number of staff who tested positive through our testing center. It's unclear yet as to whether or not this was due to the easy access of using our testing site, or if it in addition is related to their increased risk of developing COVID-19, both due to their exposure as well as their age and comorbidities. When we compare the total number of positive cases to all the cases reported, we were able to find that we increased student testing through our testing center by 27%, and we increased staff testing by 34%. So we do feel like the addition of this testing center was very effective in identifying positive cases, in encouraging the community to test and getting quick results. There were limitations. Initially, we found that there was a high number of false negatives who were symptomatic. We found this when they would go for a follow-up PCR that would come back positive. And so we did change from BD Veritor to the Binax Now cards. And we also were able to acquire molecular testing from the Utah Department of Health. So we were able to start doing Q testing, which is a rapid PCR test to verify negative or positive results when necessary. We also found that there was a tendency towards political bias at times in interpreting results, particularly pertaining to the test in an extracurricular setting. So we do recommend the oversight of a licensed clinical staff member in viewing and reporting results. And there is definitely an increased demand on staffing. It does require both administrative and budgetary support. Informal feedback from the school district leadership and the community was largely positive, both in relaying appreciation for the free access, the time to results, but the most positive feedback we received was having a local RN on site to answer questions and provide results at the time of testing. This, we do believe, increased compliance to quarantine, both for those who were symptomatic with a negative result, as well as those who were identified as positive. And it does require collaboration with the local and state health department. While we ran our lab independent of them, having them at our fingertips for questions and concerns was vital in our success. We do recommend this for other low-income or rural-based areas. We do believe it was valuable in identifying mitigation of spread. Of note, school nurses can run these testing sites independent. They are going to need support from district administration to do so. And having that online scheduling and free access increased that overall testing and thereby identified positive cases that would not have otherwise been identified. Thank you.